New at 5 as the pandemic continues, experts are worried about a second pandemic, but this one involves mental health. But Taylor Lumpkin tells us about two groups who are meeting this crisis head on.
A former youth and family center has transformed into a hub for children and teens who face significant behavioral and mental health issues.
If we create awareness around mental health, we do break down that stigma.
The Holton Youth and Family Center has a new name and will now be recognized as the Strong Milwaukee Center, a place where children between the ages of 5 and 14 who struggle with mental health can get the treatment they need.
They'll come to us for 15 hours a week, 3 hours a day.
According to a study done by the Wisconsin Office of Children's Mental Health, almost 60% of students in high school said they experienced depression, anxiety, self-harm, or suicidal thoughts in 2019. 29% of students said they felt sad or hopeless almost every day. And as the coronavirus pandemic continues, health experts fear those numbers could be even higher.
The COVID isolation has been particularly tough on them.
Officials with the Strong Milwaukee Center say they are the only facility in the state of Wisconsin to see children as young as 5 years old. They'll address behavioral regulation issues, emotional outbursts, suicidal ideation, and more.
Our younger children are going to do a lot more play to realize that they can get the things that they want to say out, the emotions out. Our older kiddos are doing a lot more talking with their therapists. Throughout the day, they will do a couple of different groups, social emotional groups.
And after having the most violent year Milwaukee has ever seen in 2020, health experts say it's critical that they address these mental health and behavioral issues sooner rather than later in order to break the cycle.
We talk about how the nervous system reacts to violence or trauma, and then what to do with that. It's really important to talk about these things, otherwise we don't affect the cycle.
If you or someone you know could use these services, you can call the center, which is open Monday through Friday and accepts family and professional referrals. In Milwaukee, Taylor Lumpkin, TMJ4 News.
Taylor, thank you very much. So why is this so crucial? We're digging a little deeper into this. Because of geographical and insurance barriers, diverse populations are more likely to delay treatment, stop treatment, and not receive appropriate therapy. That information from the Wisconsin Office of Children's Mental Health.